It's another beautiful day on Health Talk, GMC TV. I am Rebecca Caleb Minor. Today we are going to discuss a very important topic as to the World Stroke Day, a day dedicated to raising awareness about one of the leading causes of disability and death across the globe. Every year, millions of people suffer a stroke, often without warning, and their lives change in a moment. Yet, beyond the fear and challenges, there are stories of hope, courage, and recovery made possible through timely care and physiotherapy. To guide us through today's topic, we will be discussing with two specialists in the house. Please join me in welcoming Mr. Mohammed Kabir, Principal Physiotherapist at the Federal Teaching Hospital, Gombe, and Mr. Abdulhamid Saidu Shigeru, Neurophysiotherapist, also from the Federal Teaching Hospital, Gombe. You're welcome to Health Talk on GMC TV.
Thank you very much.
Let's begin by helping our viewers to understand what stroke is. Mr. Shigeru, what exactly is stroke? And what happens to the body when someone experiences one?
Okay, thank you very much. Actually, stroke is a sudden loss of neurological symptoms, which is accompanied by deficits of blood circulation to the brain, which causes usually it causes weakness of the one side or both side of the body, loss of consciousness, facial drooling, and other dysfunctions in the body. Stroke is categorically divided into two. There is ischemic stroke and there is hemorrhagic stroke. Ischemic stroke is the most common type of stroke that affects almost 80% of the individuals that suffer stroke, in which there is obstruction in the blood supply to the brain, while the hemorrhagic stroke, which is the less common one, is as a result of a rupture of the blood vessels to the brain, and it's usually deadly if medical attention is not given as soon as possible. Basically, this is what.
So, how common is stroke in Nigeria, and which group of people are at risk?
A stroke is due to the recent studies. They suggested that stroke is the incidence of stroke is becoming rampant and is alarming. Usually, stroke is stroke actually affects almost 13.5 per 1,000 population. So it's actually alarming if you consider the population of Nigeria and Africa at large. And the most vulnerable population is old age and people that has hypertension, diabetes, and obesity. These are the most affected population for stroke.
Mr. Kabri, what are the major warning signs of stroke that people should never ignore?
Thank you. The major warning signs that people should never ignore is that there is an acronyms called FAST. That FAST means F stands for face, dropping or drooling. Then A stands for arm weakness. An individual may experience arm weakness. And S stands for slurred speech. That means there may be difficulty in terms of speaking, or the voice will not come out. And T stands for time. So that time, if you notice or an individual experiences such a sign, the attention, he has to call for attention of medical, or the patient should be rushed to hospital immediately. So, and each and every time counts. Why? Because as soon as you rush the patient to the hospital, the quicker the recovery, and as soon as you delay, the patient, so the more harm it will cause, or it will result.
Mr. Saidu, what
Yes.
more signs should people be aware of?
Yes, as my colleague rightly put it, there is a severe headache with unknown cause, without any malaria or any associated disease, and problem with speaking, and loss of consciousness or confusion, and weakness of maybe one hand or both the hands, or one hand and the leg. So when this thing happens suddenly, so it's a time that we should not joke with it. Should rush to the hospital, or in the advanced world they call 911, because there is emergency response for that. So usually persons should not feel sudden weakness or facial drooling or any of the mentioned symptoms.
So what are the leading causes of stroke? Are they mostly lifestyle related or genetic?
Both, but lifestyle carries the significant portion of it. The most common risk factor is hypertension, which carries almost 80% of the risk factors. When somebody is hypertensive, so usually the body system is becoming weak. So usually in other terms they call stroke as cerebrovascular disease. Cerebral means the brain, and the vascular means the blood vessels, then disease. So usually when the blood pressure is always high, so it weakens the system, which puts somebody at high risk of stroke. So followed by diabetes mellitus, and if you sum all together, lifestyle plays an important role. Somebody is hypertensive and is not taking care of his blood pressure. There is no regular monitoring of the blood pressure. Somebody is hypertensive, is not taking drugs. So all this together put him at high risk of stroke. Plus obesity. Obesity is also a risk factor of almost all the disease and the non-communicable disease. And also smoking. As we know, smoking is one of the risk factor of heart disease, the stroke, and other non-communicable disease. Then also inactive people, like somebody that's living sedentary lifestyle. Some people they are not physically active. They don't involve in any like walking, jogging, or if it's just simple activity they will carry right instead of moving around. So God creates human body to move. So like movement is a food to the body. So it's very, very important. So if you look at how people are living nowadays, people are living sedentarily, so it's putting them at a risk of stroke also.
Okay, so like this in Africa, especially in this part of the world, people feel when they sit at home and not do anything is a sign of goodness, is a sign of good living. So you're actually telling us not just to sit at home, especially when people retire, they mostly come home and stay without doing anything. Are there also likelihood of them getting down with stroke?
I can say yes, because as I said, sedentary living is like somebody is like out of 24 hours, he will hardly move around for 2 to 3 hours. So he's just lying down watching television, and the food that we are eating is always like junk foods and too much oily foods. So all this together are putting him at risk, because some people prefer not to even move because they feel like it's kind of
luxury.
Yes, it's a luxury, while it's killing them.
Mr. Kabri, the food we eat as it stops, are there food that people should shy away from?
Yes, as he said, we should stay away from taking salty foods or food that is high in cholesterol level, or food that is sugary, for example high intake of starch, or all these soft drinks. So as we all know that these soft drinks is like there is a lot of content of sugar, which may likely cause a risk factor diabetes. So And we should improve in taking fibers, maybe like oranges. We should improve in taking a healthy diet. And when we say a healthy diet, we should dwell on vegetable and fruits. So these are important for, I think, immune system, as they can also improve the health system of the body of an individual.
People should surely eat well-balanced
diet. Yes.
Okay. So I'm interested in stroke.
Of course, yes.
Okay.
Stress may be a contributing factor. Why? Because when somebody has, maybe when somebody is engaged in physical activity without any resting, or you engage in different activities, so you see, it's like you deviate yourself from social activities. And in one way or the other, more especially nowadays in this world, if you deviate yourself from social activities, that means you will accumulate stress, which it will result to cardiovascular issues, which will lead to that stroke.
So, Mr. Shigeru,
Yes.
In a world where people are into multitasking, what would you say when it comes to stress and stroke?
As my colleague talked about stress, usually in the human body, when there is too much stress, there is one particular hormone that used to release. It's a chemical substance in the body that release, and it hamper with the health status of the human being. So there is no balance between the work and the rest. So this imbalance can impact on the one's health. So more especially when that hormone is releasing, it's put pressure to the system, more especially the cardiovascular system, the system that regulates the blood pressure and other activities, the heart rate, and it's usually important, it's equally important to take care of your resting, because some works are demanding, are energy demanding. So it's not good, like it's becoming normal for somebody, like he works for like 12 hours, and when he comes back, instead of him resting, as the stress hormone is releasing, there is opposite hormone for it, so it's usually released while somebody is taking a sleep. So if you deprive yourself of that resting, so it's putting you at high risk. So instead of that hormone to be released and balance the ratio, so you are depriving yourself, so that will put pressure on the body system, and that can be the risk factor indirectly to stroke and heart attacks.
So can one experience a stroke without the risk factor you mentioned? Like, for instance, someone without either hypertensive or hypotensive, someone without diabetes, can he just wake up one day and find out that he's down with stroke?
Yes. Some symptoms are silent. Like somebody might be hypertensive without knowing, and somebody can be diabetic without knowing, and even without these two, stroke can also happen. Okay. So it depends on how one is taking care of himself. So like we used to receive some histories in the hospital. Somebody just came back, he doesn't know that he's hypertensive, he just went to sleep, and he woke up early in the morning, he noticed that he cannot make use of one side or both sides of his body. So it can happen actually. So that's why it's important. It's like a normal unfortunately, let me say, in Nigeria or in Africa, that people are not aware of their health status. So that also is a risk factor itself. Not knowing my body system, not knowing somebody might be having so particular disease with the symptom, but without him knowing.
So if I understand you, someone cannot come down with stroke except if he has, his BP is high, low, or he has diabetes without knowing. What if the person has tested and is not diabetic, and the person has made his blood pressure is not high or low? Is it possible for him to wake up one day and find out that his arms are not working or his eyes cannot see?
Yes, it's possible. That's why they are called risk factors. They are not direct cause but there are risk factors.
Okay.
Somebody might be having heart disease. There is one particular heart disease, they call it coronary artery disease or artery sclerosis. It's actually when the blood vessel is thickened and is narrowed, so the blood flow to the either heart or to the brain is not sufficient, so it might be silent without him knowing. So when that particular thing happen, he may not know unless when he go to the hospital and he's properly evaluated and they find out. So such conditions are silent. They are silent, so it can happen. And the other one, somebody can be healthy and maybe due to some life stresses and some situations, as we used to receive in the hospital, like somebody is healthy, he came back, maybe something frustrates him at work or somewhere else, then his BP will go up suddenly, and it can reach a level whereby the blood vessel in the brain can rupture, and it can cause the hemorrhagic stroke, the less common one. So without having hypertension, it can happen all of a sudden.
So is stroke, Mr. Kabri, is stroke only for the elderly, or the young can also have it?
No, stroke is not only for the elderly. Young can also have it, more especially obese individual. Yes, they can also have it, more especially those that are smoking or those that are taking too much of alcohol, because as they are smoking or taking too much of alcohol, as we all know, is toxic, and that toxicity of the alcohol or the nicotine that is inside the cigarette will intoxicate the blood, and it will lead to maybe blood forming, a clot forming in the blood vessels within the brain, so that there will be inadequate blood flow to that particular part of the brain, which will lead to the stroke.
Mr. Shigeru, today is World Stroke Day. Could you tell our viewers what this World Stroke Day is and the theme for this year?
Yes, the World Stroke Day is a day that is specialized for spreading awareness and campaigns for the stroke, and is being celebrated on each and every 29th day of October, and it was initiated 2006 by the World Organization for Stroke. So it's a non-governmental organization which comprise of different healthcare professionals and some stroke survivors. They came together to come with a program that will spread awareness of campaigns on this stroke, because people might fall at risk of stroke without them knowing, or they might have some symptoms without them knowing. So that day is mainly for spreading awareness, and the theme for this year is FAST, as my colleague earlier said it. F stands for facial drooling, when the one side or both side of the face is lost control or the tone, so one side of the face will deviate to the side, and the A,
there's a disfigure of the face.
Yes, that is, we call it asymmetry. Okay. So it's asymmetrical. And the A stands for arm weakness. So we usually assess by asking patient or an individual to raise his hands together. So if we notice one is weak, so it's a sign of stroke. And the S stands for slurred speech. So somebody with a stroke, he has difficulty to speak or to articulate the words. And the T stands for time. That time is time to call 911, but in our local societies, it's time to take the patient to the hospital. It's time to seek for medical attention. So that will go a long way in minimizing the damage, because the brain has cells, and when stroke happens, in every minute 1.9 million neuron cells are dying due to the lack of blood flow to the brain. So that FAST acronym is go a long way in taking care of the complications that will happen after the stroke.
So now let's talk about recovery, an area where you work as physiotherapist becomes fighter. Mr. Kabri, what role does physiotherapy play in the rehabilitation of stroke survivors?
Actually, physiotherapy play a major role in terms of treatment of stroke. They do use some movement, more especially movement of the body part that is lost. So they do make that movement to re-educate the brain again in regenerating the function that lost. For example, maybe your hand, you cannot be able to make use of your hand. In all of the joints of the hands, there are some particular movements which initially, before the incident of the stroke, you can be able to move the hand, but after the incident you cannot. So for each and every joint there are some particular movements that an individual will do. So and the physiotherapist will train that individual on how to make do that movement, so that for the brain to in order to retrain the brain on that particular movement.
Okay,
and their use of machineries, more especially when there is stiffness. A machine like infrared is being able to use for the patient, so that they will increase blood flow, so that the joint will be softened and they can be able to move the joints softly.
Mr. Shigeru, are there more roles that physiotherapy play in reviving stroke survivors?
Yes, there are more roles. Actually, we are at the forefront in the management of stroke. To achieve a successful recovery in stroke, multidisciplinary team has to come into play. There is neurologists, which are specialized in the brain. There are doctors that specialize in the brain, cardiologists for the heart. So if you look at the stroke, it affects it's multi-system affectation. So physiotherapists, after stabilizing the patients, after the neurologists, the cardiologists, the endocrinologists that take care of the blood sugar, they did their own part. They stabilize patient. They are at the first contact. Then immediately, then they will call us and patient will be referred to us. So as early as possible, even patient is unconscious, we start our own interventions, which involves we carry the patient relative along in giving them education about the condition and the role that they are going to play. We do that. Also, we start the movement, because without early physiotherapy intervention, body has its own way of bringing some complications like the joint stiffness. So we start the movement as early as possible, and even the positioning, how we position patient to take care of some complications, because patient left like that without there is therapeutic position, we put patient in a place whereby the blood flow will be enhanced. At the same time, the patient cannot move the part. And also there are some complications like deep vein thrombosis, where the blood clot or freeze within the blood vessels. So without a proper positioning and early movement, that complication can occur and is fatal. When it happens, it can lead to somebody's, it can cost life. So physiotherapist plays a crucial role in putting therapeutic positioning and the movement as early as possible. So we are movement experts, and movement is, as I said earlier on, movement is a food to the body also.
So can you describe some of the common physiotherapy techniques or exercise used for stroke patients?
Yes, we have them in abundance. We have different approaches. We have proprioceptive neuromuscular facilitation. We call it, we give it PNF. PNF simply means a body, because body movement is in diagonal pattern. If you are receiving something, you not go like this. So we in multiplanar movement. So it's part of it. We teach the body that lost function, we teach it that particular body part into that diagonal pattern. So that technique is called PNF. And we also have constraint induced movement therapy. If somebody right side is affected, is weak, so we carry this one and tie it, and we force that weaker part to move. So we use that technique to teach that somebody to use that weaker part. Like if the right, for example, is affected, so despite the hardship, we force the right hand to eat using spoon. And also we have the modalities, like you said, infrared radiation for improving blood flow to the body. We use electrical muscle stimulation. We use some electrical modalities to activate the body, like when the muscles are weak. They said paralysis. Yes, the muscles can undergo paralysis. So we use that modality to train the muscle, like to activate it. Once we start having some movement, then we facilitate using that PNF, proprioceptive neuromuscular facilitation. And we have splinting. We have some gadgets. You may see somebody, his hand is, or his arm is hung like this. So we use such modalities also, because when the hand is left, like if it is completely weak, so it can dislocate. So we use some such as splintings, some gadgets to hold the hand in a good position that will enhance the blood flow and etc. So these are some of them actually.
Okay, so how important is consistency and movement in a patient's recovery?
Yes, according to the guideline and recommendations, at least patient should be seen minimum of 3 times a week when he has stroke. And a stroke is a disease whereby you cannot rush. It depends on the extent of the damage to the brain. So some might recover within maybe 1 or 2 months, some might recover within 3 months, some might recover within weeks. So, but it depends on the consistency and the area of the affectation and the extent of the damage that the brain has. So one has to be consistent as much as possible, if possible 5 times a week. But at least due to the nature of human being, at least there should be resting sessions. Maybe 2 days should be off or 3 days, but minimum should be 3 times a week.
So what if the patient is an outpatient?
Yes, in the hospital setting we have inpatient setting and outpatient setting. When patient is hospitalized in the hospital bed, so we give him inpatient services when the stroke is at the early stage, and that one is more consistent because we give like minimum of 5 times a week or 6 times. But once patient is discharged, it means the patient is a bit stable and it will be discharged home. Then we give equal appointment. Patient should be coming from home.
Comes to the hospital.
He comes. The departments are all over. Like here in Gombe, we have department in Federal Teaching Hospital Gombe, and we have department in the State Specialist Hospital. Our colleagues are there, and each and every general hospitals across the state, we have our physiotherapists there, and they are ready to help.
Okay, Mr. Kabri, can someone who has lost movement any other side walk again with physiotherapy?
Yes.
Okay. How is it possible?
With intense physiotherapy, you can be able to walk again. Okay. Yes.
So how? What do you do? What magic or miracle happens when somebody? Because there are times we see somebody is not moving. His legs are not moving, and it's either his legs or arms. What do you do?
Yes.
To rehabilitate this person.
At flaccid stage, there is what we call at flaccid stage. That means he cannot be able to move both of his limbs, maybe the hand and the leg. So there are some movement we give. We call it passive movement. You follow all the joints. Maybe starting from the fingers. Maybe you have at the fingers we have flexion, extension. You follow all the joints. You keep on doing the movement repeatedly. Once you are doing it repeatedly, it seems as same as you are re-educating the brain regarding the movement, because once there is stroke, the brain will forget all about that movement. Then at the wrist joint too, you do flexion, extension. There are about 4 movements in the wrist joint. We have flexion, extension. We have radial and ulnar deviation. And at the elbow joint too, You do it repeatedly. There is what we call flexion, extension, and there is what we call supination and pronation. That means at the radioulnar joint. Then you go to the shoulder joint. You do flexion, extension. Then you do internal rotation, medial rotation. So, and you do retraction and protraction at the elbow joint. Likewise, in the leg too, there are some movement. You start with that one. And once movement is being initiated, then you can progress to what we call active exercises. That means the patient can be able to initiate or move his limb. Then you ask him to be doing it repeatedly. Once he graduated from that, then you go to active resistance. That means at that stage, maybe he might gain some strength. You put the resistance and you ask him to do it actively while you are resisting, so that you will increase strength.
Well, viewers, if you are just tuning in, this is GMC Health Talk, and we've been discussing stroke. Today is World Stroke Day, and we've been discussing stroke, recovery and prevention. And with me in the studio are experts, the physiotherapists, and they are telling us how the role they play in ensuring recovery of stroke survivors. So now let's go beyond the recovery. Let's consider the prevention and the support systems around patients. What are some of the biggest challenges physiotherapists face while managing stroke patients?
There are so many. If you look at the stroke or any other neurological, when we say neurological, any affectation of the brain and the spinal cord. If you look at the brain, is the central controller general of the body. Any activity of the human body is being controlled by brain. So we have these misconceptions by the public. Okay, whenever something like this happens, somebody is working abnormally. So people just make conclusion, okay, this thing is spiritual. So we have these challenges. Patient will not be brought to the hospital at initial stage or at early stage until unless when the damage has been met, some complications set in, then they brought somebody. When they bring that somebody, some damages are irreversible. So the major challenge that we are having, the early intervention is not that available. Usually people tend to come to the hospital after when the traditional medicine failed, or the spiritual one, because they used to say traditional, but as far as I'm concerned, it's spiritual. Out of 8 to 9 out of 10 that says they tried traditional is spiritual. Somebody will give you some things that I don't know how to put it. So it's a big challenge.
Especially when you know that if you were brought early, there's something you can do.
And sometimes you feel like, okay, so why will you come now? But as a healthcare providers, we don't do that. Still, no matter how. But that is the reason why we need to spread more awareness about this stroke. The moment you see the signs, bring that patient to the hospital, because they used to say it's like in Hausa term, jipa akai masa, and that is wrong.
And they take him to.
They will take him to. There are so many villages around Gombe and neighboring states that people they are collecting their money and they are spreading lies. That okay, this thing is a devil that catch the spirit, this and that. So this is the most challenging thing in physiotherapy, and the consistency. That one is a different issue, but the first one is the most challenging. Then the second one is the financial constraint, because physiotherapy services is something that is a rehabilitation, so it takes time. It's not something that you come I write broke. No. We may spend maybe months, weeks, or some of the patients even years before they recover. So once somebody start coming, he start receiving the treatment, maybe first or 2 months, then he give up. Sometimes we take an effort to even reach out to them on phone. Okay, why did you stop coming? I say, I can't keep it on. So it's actually challenging. We feel like sometimes we even go to house by house to give our services, but it's beyond our power. We also need to take care of our health.
So what kind of support should families and caregivers provide during rehabilitation?
Actually, the family should encourage the patients by maybe encourage them in terms of social activity. Maybe they should take them where they should interact with relatives, and they should make sure that they are monitoring their home programs, because the stroke patient, after the receiving the treatment in the hospital, they will be given a home program that they will be doing at home. So the family members should make sure that the patient are doing their home program regularly. And they should make sure that
the home program, has it got to do with exercise, feeding,
yes,
or anything?
they will prescribe some exercise for them to do at home.
Okay.
And they should also make sure that the patient are consistent on their physiotherapy. Maybe attending to clinics. They should be attending the clinics regularly. So it's also part of the assistant. And they should also make sure that more especially patients that are always in a lying position, they should be changing their position in order to avoid what we call bed sore. And if the patient are walking, they should be close to them in order for the patient, or the patient should not be at risk of falling. So I think
so caregivers actually have a role. It's not about the physiotherapists and the patients.
yes.
Caregivers also have a role to play in recovery, rehabilitation of patients.
Yes, they have, as you rightly put it. Above all, the patient that suffers a stroke, they used to have, not apart from the physical symptoms, there are psychological, there is cognitive
Somebody is
impairment.
used to active life, and
Yes.
all of a sudden you're down.
You see that somebody is a professor, is a doctor, whatever, but after a stroke, he may lose all this experience and knowledge. So he will be depressed, frustrated. So that psychological support is very, very important. And the first person to give that is the family member, or the maybe the spouse, or the siblings. So they play an important role. That's why part of our first line of management, after we design the protocol, the first one is family and caregiver, patient, family and caregiver education. Because if they don't know or they don't understand what stroke is all about, they may not have that knowledge of how to take care of that individual. He may create some unusual behaviors which they might see like it's a negligence or it's like intentional something, but it affects their psychosocial functions, like the cognitive, the thoughts, the problem solving, the thinking, the reasoning, and so forth. So without proper understanding of the family member or from the family member, that home program cannot be achieved. So we first sit with the patient relative, we educate them, okay, what is stroke is all about. So you expect such kind of things. He may be frustrated, he may be agitated, etc. So we educate them, okay, be patient. They should be more patient than him. And him too, he can easily be angry. So we teach them, okay, it's because of this you are angry. So there are so many roles that the family member plays actually.
And I think also the patient relative needs to be counseled, like you said, what you do.
Yes.
Because sometimes they do it out of not ignorance.
Yes.
I remember I was in a hospital with a patient. I was called as a patient relative to be counseled.
Okay.
What is expected. So if such things are done in our hospitals, the patient relative knows he has a role. It's not just about sitting down, giving water when it comes, or medication, or just what do you want. If the patient relative is also enlightened, like you said, you also, I think it will also help the physiotherapist in doing some of these things. And there are cases of the patient complain, I don't want to do again, I don't want to do, there are pains, I've experienced pains, I don't want to do. So what do you do with such patients?
Yes, that counseling is very important, more especially when the patient is literate. So we find it more easier, okay, while educating him, okay, there are some stages of recovery. Some stages they come with pains, like in the later stage, there is what we call stage of spasticity. That spasticity is like the body part is becoming stiff. It's part of the recovery.
Okay.
Once the movement is coming back, day one is weak. He cannot even feel it. Now, as time goes on with the physiotherapy, he started feeling he can live but abnormally, in abnormal pattern. So it comes with spasticity. That spasticity is when the brain is rejecting the movement. So when that stage came, it comes with pain. It comes with pain. So we first educate patient, okay, you are in this stage. And we also educate the patient relative, because even helping the patient to move around at home is difficult. He don't want to be touched. He restrict that area. So we educate both the patient and the patient relative. Even us that we are delivering the exercise interventions, we used to be cautious, and we used to be careful while giving that movement, because patient can even, some they cry, some we even use, we need to be extra patient before we take care of that situation. So actually we are not only giving movement, I think we should be called also psychologists too. That's why we do psychology, sociology, etc. In our curriculum.
So Mr. Kabir, apart from therapy, what lifestyle changes can help prevent stroke or a reoccurrence?
Yes, life changes can help. More especially if an individual engage in physical activities. Maybe initially you cannot is a individual that doesn't engage himself in a physical activity. By engaging in physical activity, maybe it will help. Maybe by monitoring the diets, an individual, maybe you should be watching your diet, avoid all those what we've mentioned earlier on, and maybe by even engaging in social interactions, maybe in sport activities, or maybe maybe engaging in any other social activities. So it will go a long way in preventing the condition.
So are there specific exercise that someone should do? Because there are instances people die after an exercise. Are there specific exercises that somebody can do to survive?
Yes, there is. Actually, it's not advisable for somebody that has never done exercise, just wake up today and start running like this. No. So based on WHO recommendations, they says every individual must engage in mild to moderate physical exercises for like 150 minutes per week. So if you break it, it will give you like 30 to 35 minutes per day for 4 days. So we are movement specialists. We advise individuals to contact us. Okay, some they have cardiovascular issue like a heart problem. So these are the individuals that usually have death incidences after exercise. Maybe they overdo. So they said mild to moderate. They didn't say severe. So mild to moderate intensity. That is the volume of exercises. That is the World Health Organization recommendation. So for that, they should meet the movement experts to give them, okay, what are the mild to moderate exercises? Like normal walking, at least if you can go out and move around for 30 minutes, just normal walking. Then you start gradually, you are increasing the intensity, maybe the volume of your walk or the time. You understand? Some they consider the distance. Okay, I covers 2 kilometers today while walking. So if you look at walking, it wouldn't be like that bad for somebody to start with. Then gradually you are walking, then you start jogging gradually. Then you progress if you are interested to go for
that's for the young
running.
Because
yes.
for the old we don't
even for the old, like normal walking is important. But the most important thing is don't start without consulting the experts. Yes.
Don't assume because it worked for this person.
Yes, it will work for you.
Because most people copy because it worked for this person. Let me just do it.
Yes.
Okay. So can someone who had a stroke live a normal life again, Mr. Kabir?
Yes. Someone with stroke can live a normal life, actually, more especially considering the level of damage in the brain. Maybe at times, if the level of the damage is not that severe and the attention, medical attention was taken immediately, maybe that an individual was taken to the hospital immediately where a physiotherapist has come into intervention and he did all the regular exercises or all the necessary treatment that he's supposed to receive, so he can walk, he can go back to normal.
Okay, Mr. Shigeru, do you want to say something about that again?
Yes.
Can somebody who had a stroke live again? I mean, can he go back to his normal life? Can he walk again? Can he use his hands again?
Yes, we have a lot of them.
Okay.
As he's rightly put it, it depends on the severity of the condition, how the brain is affected, and secondly, the prompt action that was being taken after the stroke. So when the damage is like minimal, so somebody can lose the arm function and can be restored. So we have so many of them in the hospital, and some of them they were discharged. So I can say yes, but we consider some factors. Even if you have mild affectation and you didn't receive any medical attention, so it can be irreversible. So prompt action is paramount, and the second thing is what happened up there. So if the damage is less, but some damage are irreversible. That's why the recovery is, some they recover 90%, some 80%, some even 100%. Somebody may not notice that he even had stroke.
So what advice do you have for people who cases are not reversible?
Yes, actually such people, we can't say, like, we can't give up, like you will not come back to normal. But at least somebody that in day one he cannot even sit up from lying position. Now we teach him how to do that. We teach him how to stand up. We teach him how to walk, even if it is not fully normal but near normal. So our goal is either normal or near normal. So in Hausa they used to say, but you are far better than somebody that didn't receive any treatment. But for sure some they recovered fully.
Okay, so as we wrap up, Mr. Kabir, what message would you like to leave for the public as we commemorate World Stroke Day?
Okay, thank you. I will urge the public to take this condition serious, more especially if they experience the warning sign. So they should take it serious, and they should quickly rush to hospital to seek for medical attention. And we are pleading for a government to engage in many programs or give maybe some interventions for individuals with stroke conditions. So we also urge for maybe GMC Gombe to maybe can I say they should also be giving us chance to come
like we just did now.
Yes, like the way we did now. So we should be doing programs through TV or radio regarding this condition, so that we should give awareness to public.
Okay. The role of government, communities?
Yes, actually the government at the higher level plays an important role, because if you go to advanced world, they provide all the necessary support. The governments provided all the necessary support for the stroke survivors. So like ambulance, availability of ambulance, because if somebody has stroke from a village, he may not have that opportunity to come as early as possible. So based on the recommendation, 2 to 3 hours after stroke, the damage, some of the damage may be irreversible. So in an advanced world, we have a colleague of ours that just recently came from UK. What he told us was, okay, they have even helicopter ambulance due to the high importance of emergency response to that stroke patient. As I earlier said, 1.9 million brain cells die every minute after stroke if medical attention is not given. So the availability of ambulance and healthcare facilities across our localities will play a vital role in containing the complications that will come after the stroke. So that's we cannot do that. Only government can help with that. And some of the diagnostic tools that we are lacking, but thank God we have 2 in Federal Teaching Hospital Gombe. But I think if you say like 6 months back or 7 months, sometimes when stroke happen, the patient has to sponsor himself or the relative to take the patient to Azare or Bauchi or Kano for the CT scan. And without this CT scan, we may not know what exactly happened up there. So you see, government need to come into play to provide all the necessary tools, the diagnostic tools that will help the healthcare practitioners to understand, okay, this is what happened in the brain. Then we look at, okay, what interventions should be given to that individual. And also the public, this is the most challenging thing, and it's always in my mind. People that are going to these spiritual practices is heart touching. Yesterday I was with my client in the clinic, and the relative was telling me, okay, they traveled to Kumo some months ago. They took the patient to one person, and he gave them some false hopes. He gave them something to cut when they reach home, and it's like a spiritual, something like it's a devil that carry some fluid from his body. So, and all these are lies. This is stroke. We know what is happening. We have so many of them. They have some villages. If you permit me, I can call them. People are going there, and after the damage, they will come back to us. And we don't know what to do at that moment. Some damages are irreversible. So we urge the public to please be serious with their health. If your family member have stroke, we mentioned the early signs. Just quickly take him to the hospital. We have State Specialist Hospital, Federal Teaching Hospital Gombe, Zainab Bulkachua, among others. We have so many, even private hospitals, and I'm very sure they will do the needful. So by so doing, we are taking care of the further complications, and the expectancies of that patient's condition will be good. But if you come at the later stage, so we can do what we can do.
So what advice do you have to our traditional rulers, our spiritual fathers? Because I see they have a role to play in this.
Yes, there are 2 different things. There are people, yeah, I agree. If you look at from religious point of view, we have some spiritual issues. That one is different. But one thing with them is, when they notice that, okay, this is beyond my power, it's not spiritual, just refer patient. But because so due to the interest of monetary gain, they will hold that patient, they will exhaust him financially, they will exhaust him, they will even give them some toxic substances that may even worsen the condition. And that is unfair. If they are sick, they will come to the hospital. But if they came to them, they will give them some herbs. So please, they should do the needful, because one day they will fall a victim of such conditions, and we may not know. And they say karma is
So Mr. Kabi, what hope or encouragement can you give to stroke survivors watching us today?
Actually, the hope that we will give them is that they should, once if they got stroke, it's not the end of the world. They shouldn't think that maybe they will not get better or they will not go back to their normal activities. No, they should, what the advice that we will give them, that they should quickly rush and come to the hospital. They should visit their physiotherapists and do the necessary things. So stroke, with quick intervention, they can be able to go back to their normal activities.
Mr. Shigeru, your final word to our viewers.
Okay, I would like to say thank you for the thank you to the GMC Gombe for giving us this opportunity to spread this awareness about the stroke, and to the public, please take care of your health, more especially those that are diabetic. those are hypertensive, they should take care of their blood sugar and regular monitoring. For the hypertension, they should be regular and monitoring their blood pressure. And to the government, we are calling the government to do all the needful to the healthcare facilities in order to improve the healthcare delivery for the betterment of the public. And also, we are calling for anybody that has stroke or his family relative has stroke and is remaining at home to come to any nearby hospital. Thank you very much.
Thank you so much, Mr. Kabiru and Mr. Shigaru, for sharing your expertise and compassion with us today. Thank you for coming to GMC TV for this program. To our viewers, a stroke can change life, but recovery is possible with early action, professional care, and unwavering support from family and community. Remember, time lost is brain lost. If you notice sudden weakness, speech difficulty, or facial dropping, don't wait. Seek medical help immediately. On this World Stroke Day, let's all commit to healthier living and stronger awareness. I am Rebecca Caleb Minor saying thank you for watching.